वेलकम नर्सिंग स्टूडेंट्स, स्वागत है आप सभी का आज के इस प्रीवियस ईयर क्वेश्चन पेपर सॉल्यूशन में। पिछले कुछ सालों के पेपर आपकी स्टडी और खासकर आपकी स्मार्ट स्टडी के मोस्ट इम्पोर्टेंट पार्ट होते हैं। इन क्वेश्चन पेपर से आपको एक आइडिया आ जाता है कि किस तरीके के क्वेश्चंस एग्जाम में पूछे जाते हैं, और कई बार ऐसा होता है कि सेम क्वेश्चंस भी रिपीट हो जाते हैं। और मोस्ट इम्पोर्टेंट आपकी तैयारी का आकलन हो जाता है कि आपकी तैयारी किस लेवल पर पहुंची है और अभी आपको और कितना ज्यादा दम लगाने की जरूरत है। तो डियर स्टूडेंट्स, हो जाइए तैयार अपने हाथ में नोटबुक और पेन लेकर, और देखिए कि इन आने वाले 100 क्वेश्चंस में से कितने क्वेश्चंस आप सही करते हैं और कितने क्वेश्चंस आपसे गलत होते हैं। फिर आप कमेंट बॉक्स में बता सकते हैं कि आपने 100 में से कितने क्वेश्चंस सही किए हैं और आपकी तैयारी कैसी चल रही है। इसके अंतर्गत पहले आपकी स्क्रीन पर क्वेश्चन शो होगा, उसके कुछ ही सेकंड बाद ऑटोमेटिकली जो राइट आंसर होगा उसके ऊपर टिक लग जाएगा। इससे पता चलेगा कि आपका आंसर सही है या गलत। इसके बाद नेक्स्ट क्वेश्चन शो होगा और इस तरीके से सारे क्वेश्चन दिखते जाएंगे। आइए चलिए सॉल्व करते हैं राजस्थान CHO प्रीवियस ईयर क्वेश्चन पेपर 2020। फर्स्ट क्वेश्चन, व्हेन इज सेलिब्रेटिंग वर्ल्ड हेल्थ डे? 7 अप्रैल। क्वेश्चन नंबर 2, हु इज द प्रेसिडेंट ऑफ इंडिया? श्री रामनाथ कोविंद। क्वेश्चन नंबर 3, when was came into force MTP Act in India? 1972. Question number 4, which one disease is eradicated from India? Polio. Question number 5, who is known as the father of Green Revolution? M.S. Swaminathan. Question number 6, when was the started Swachh Bharat Abhiyan in India? 2 October 2014. Question number 7, which process is responsible for global warming? Greenhouse effect. Question number 8, which disease is transmitted from fecal-oral route except measles? Question number 9, most common cause of death in diarrhea? Dehydration. Question number 10, most common cause of under 5 mortality? Pneumonia. Normal capillary time in children? Less than 3 seconds. Which milestones developed in 6-month-old baby? Able to sit with support. Normal weight of a newborn at birth in India? 2.5 to 3.5 kg. Minimum time for KMC in a session? 1 hour. Labor room's temperature should be maintained 26 to 28 degrees Celsius. Which immunoglobulin abundantly present in human milk? IgA. Beneficiaries of ICDS scheme? A and B. Complex sport is the cardinal sign of? Measles. Rich source of calcium? Milk. All of the following micronutrients except vitamins. Which one is the water soluble vitamin? Vitamin C. Rich source of vitamin E. Sunflower oil. Route of BCG vaccine? ID. Deficiency of vitamin C lead to which disease? Scurvy. In a baby, complementary food should be start at 6 months. Which nutrient is essential for tissue repair? Protein. All of the following clinical features seen in dengue fever except low grade fever. Full form of VVM? Vaccine while monitor. Dose of vitamin A at 9 months. 1 lakh international unit. Which chemical used for decontamination of COVID-19 area? Sodium hypochlorite. Treatment duration of MDT TB should be 18 to 24 months. In a pregnant woman, the interval between two doses of TT vaccine should be 4 weeks. Which vaccine given at the time of the birth? BCG OPV hepatitis B. Causative organism of COVID-19. Virus. Total number of bones in human body 206. Which test used for diagnosis of tuberculosis? Montauk's test. Largest gland in human body? Liver. Which hormone secreted by testes? Testosterone. Which informed carbohydrate stored in liver? Glycogen. In a community, first case of the disease is known as primary case. Infant mortality rate of Rajasthan 37 per 1000. Full form of BMW. Biomedical waste. While measuring the blood pressure, the tubes of the instrument should be placed inside the hand. Presently, total fertility rate of India 2.2. Which test used for typhoid diagnosis? Vidal test. Where is located headquarters of WHO? Geneva. Which chemical used for water purification? Bleaching powder. One PHC should be established at 30,000 population. Presently MMR of Rajasthan 164 per 1 lakh. When was conducted last census? 2011. How much population of India compression to world? 17%. After chlorination process of free residual chlorine in drinking water is 0.5 mg per liter. When was the national population policy implemented? 2000. When was launched NRHM program in India? 2005. One ASHA can be posted on every 10,000 population. Which disease is eradicated from India? Guinea worm disease. According to Birth and Death Registration Act, birth registration should be done within 21 days. Route of administration of measles vaccine. SC subcutaneous. Normal BMI for an adult 20 to 25. In the children with ORS solution, which substance should be given in case of diarrhea? Zinc. Which medicine commonly used in PPH? Oxytocin. How to calculate EDD? 9 months plus 7 days. Normal respiration in pregnant woman 18 to 20 per minute. When will we detect FHR by fetoscope in pregnant woman? At 20 weeks. According to WHO, anemia can be defined in a pregnant woman while HB level less than 11 gram per dl. Full form of IUCD. Intrauterine contraceptive device. Normal FHR is 120 to 160 per minute. Diagnostic tests should be followed in ANC. HB urine sugar, urine albumin. A pregnant woman get a TT vaccine 4 months earlier. Now she come in the hospital after 8 months. What will you do? Option B. Which chemical used for testing of HB? NaOH. In the ANC visit, a pregnant woman should be tested HIV, hepatitis B, syphilis. How much time interval between alert line and action line in a photograph? 4 hours. Breastfeeding should be started following birth within 1 hours. How much blood lost in a normal labor? 500 ml. After labor, the placenta should be discarded in yellow bag. Most common cause of MMR in India? Hemorrhage. After unprotected sex, emergency contraceptive tablet should be taken within 72 hours. Postpartum sterilization should be done after labor 24 hours to 7 days. After vasectomy, additional contraceptive methods should be used up to 3 months. Levonorgestrel IUCD should be changed every 5 years. How long effective NET-EN contraceptive? 2 months. Most common side effect of IUCD? Excessive menstrual flow. Which method used for diagnosis of HIV? Western blot and ELISA. Most common nutritional deficiency disorder seen during adolescent age? Iron deficiency anemia. Most common cause of death during adolescent age? Road traffic accident RTA. Testosterone hormone is found in both males and females. Dose of albendazole in adolescent of deworming 400 mg OD and HS. Non-communicable disease is it cannot transmit from one person to another. Normal blood pressure of adults 120 by 80 mm Hg. Cardinal sign of diabetes mellitus. All of the above. Normal range of HbA1c in adults less than 6%. Diabetes mellitus can be considered if RBS level then more than 200 mg per dl. Most common complication of diabetes mellitus. Hyperglycemia. How to spread cancer in human body? B and C. Cause of cancer of breast except lack of physical exercise. How to affect tobacco consuming during pregnancy? Low birth weight baby. Best time for breast self-examination 7 to 10 days after first days of menses. Insulin is given. Type 1st diabetes mellitus. Daily iron requirement of an adult is 100 to 150 mcg. Which vaccine used for prevention of cervical cancer? HPV vaccine.